terms you need to know before your first radiology shift. And honestly, most of them sound like a foreign language. Let me walk you through the ones that actually matter. Anteroposterior, or AP, just means the X-ray beam goes from front to back. Anatomic position is how we describe the body standing upright, palms facing forward. Atelectasis is a collapsed lung, and you'll see it on chest films all the time. The acetabulum is the hip socket where your femur sits. Ankylosing spondylitis is a type of arthritis that fuses your spine over time. And automatic exposure control, or AEC, adjusts the radiation dose for you automatically. Did you know that a boxer's fracture isn't actually from punching someone? It's from punching a wall. When you hit something hard with a closed fist, the fifth metacarpal bone breaks. That's the bone behind your pinky knuckle. Now, a Bennett fracture is different. It's at the base of your thumb, and it's way more complicated to fix. Then there's the buckle fracture, which is honestly kind of genius. The bone doesn't snap, it just compresses and buckles like an accordion. And here's the thing, bone density actually determines how you fracture. That's why doctors use bone densitometry to measure your BMD before certain surgeries. Your bone composition literally predicts your injury pattern. Bone mineral content, BMC, a measurement of bone mineral in the total area of a region of interest. COPD, acronym for chronic obstructive pulmonary disease, encompasses several diseases that cause chronic, persistent obstruction of bronchial airflow. Central nervous system, CNS, the portion of the nervous system consisting of the brain and spinal cord. Coordinate sensory input and motor output. Chorion, part of the nutritive and protective covering of the fetus, consisting of two parts. 1. The outer layer of protective membranes enclosing the fetus, and 2. The embryonic portion of the placenta. Cleft palate, a congenital defect of the roof of the mouth, consisting of a longitudinal fissure resulting from failure of the maxillae to fuse during fetal development. Compensating filter, a specially designed attenuating device used to improve image quality and provide even density on body parts that vary significantly in tissue thickness or mass. Contrast arthrography, radiologic examination of the soft tissues of joints after injection of 1 or 2 contrast agents into the capsular space. Contrast medium, plural media, substance used to increase the contrast of structures so that the structures will be visualized on radiographic images, may be positive radiopaque, negative radiolucent, or a combination double contrast. Computed radiography, CR, a digital imaging modality in which an X-ray tube is used as the source and a phosphor plate as the image receptor, IR. Conventional X-ray equipment is used for CR, but the IR is processed by a laser reader and the image is displayed on a computer monitor. Once you know these basics, reading imaging orders gets so much easier. You'll stop second-guessing yourself and actually understand what the radiologist is looking for.